An entrainment device. I spoke earlier about some of the neurofeedback we do, which is literally brainwave training. It's biofeedback of the human brain. And you know, the brain is all about connections. We're born with 100 billion neurons, but how those neurons are connected is really where all the action is in research these days. And your experiences change those connections. Well, we know, for example, if a patient, let's say, has ADHD, they're producing too many slow theta waves. So the neurofeedback sessions are designed to reward faster brain waves. But that's not enough. So we send them home, and every night they've got to spend 20 minutes with a machine like this, which is just sending in beta waves. And the differences are dramatic. You take a patient you're doing neurofeedback with, and they're not using these at-home devices versus using them. It speeds up treatment 2 or 3 times. And the other thing is compliance. If the patients know they're going to be busted for not doing it, they're much more likely to comply with the treatment protocol. So technology is really helping us.
So in that respect, you're bringing up there's different strokes for different folks. That severity might dictate whether someone goes into intensive in-person versus greater reach versus what someone might respond to versus not respond to. And there's a lot of different products that allow for those types of personalized medicine. And one of the things I'm wondering is, with a little bit of the time we have left, is where have you seen maybe it not work so well? And what do you see might be the fix? And so, for example, the law of attrition in mental health apps is huge. People download an app, and if there's no human support, they don't use it. They just don't use it. People are not using apps over time. Whereas you're building products, you're building public health solutions that are engaging people, and you are all the successful ones. So I'd like to hear maybe a little bit about what has not worked, how you've adapted, what you would like to think about in a different way as we move forward as a final. Yeah.
It's interesting you say this, because this is how you and I met. In terms of using devices, there are some excellent apps and actually standalone devices that patients can benefit from, that they just, you know, unless they're seeing a therapist on a weekly basis, people flat out don't do it. They're just too lazy. I mean, you can barely get people to take a pill once a day. That's been a colossal failure as far as I'm concerned. You can build the best device in the world, and people are just not going to do it. That happened with the stress eraser.
I think the biggest failure is called the United States healthcare system, and we're talking about 60 million people with
culture.
Let's not get into that. You know, it may turn political. The 60 million people with a diagnosable mental health condition every year in the United States, 40 million are getting zero, nothing. That is the failure. That's the market failure. And for me, therefore, while I'm in love with this kind of approaches, I think we need something much more fundamental that allows the millions of people that either can't afford or can't access or don't know or are too ashamed to get some kind of help to begin with. I think this will be the major change. So that's our vision. That's what we're trying to solve.
Agreed. Technology isn't the failure point. Technology you can iterate on really fast. You know, we made mistakes and we've learned from them fast. We've put programs together that now result in a place where 85% of the visits every day on our platform are repeat visits. Right? These are patients who are coming back and doing this. Patient drop-off rate is under 20%, which for mental health is crazy high.
That's great. I wonder if you could also add in, what did you change? Because as we build technology products, we're constantly iterating. We've failed a lot.
I would love to go into it, but what I was going to finish off with was the part that we haven't been able to solve. What we still struggle with is being able to coordinate between a patient's needs and the ecosystem around them that's available to them, whether it's the payer infrastructure, whether that's the reimbursement infrastructure to Medicaid. Those are the things that, that still fail us, and our inability sometimes to effectively sort of provide the glue that makes these things work. That's where the gaps are today. So, and that's where there's a lot of opportunity for people in the room, and that's where we're really excited to see, the kind of things you're doing, where it's just sometimes not possible for the private sector to come in and solve certain things, right? Like when plans change on us, when CMS changes things on us, it's going to take us time to respond to that, right? And some people will fall through the cracks. We serve University of California, all the faculty and staff and the family members. It's a direct benefit. It's available to them at-home therapy. And this year they changed their plans, right? They changed their insurance plans this year, and some of the patients who we're serving are going to fall through the cracks. So I'm spending my last few weeks just trying to scramble and see what can we do for these patients who are now not covered, who've been seeing our providers, what's going to happen to them. And it's, as a commercial entity, sometimes you're like, okay, that doesn't necessarily align with my business interests, but these are patients. You can't just leave them hanging. So you have to work with other entities to figure out the solution. So really, the answer is you guys. Sorry, not to put too much of a burden on you.
I'll take it. Yeah, so there are deep structural issues that have to work in tandem with these opportunities to multiply access and improve outcomes. That's part of the role, should be part of the role of government. One thing that we've done for the first time is acknowledge the huge challenge that we have. The mental health is the public health challenge of the 21st century. It affects most people, certainly most households, most workplaces, most schools, our criminal justice system, our healthcare system. But we treated it as a very narrow, select, isolated sort of issue from a public policy point of view. Yet it is a preeminent social policy challenge. So we have to treat it that way. Which means that the array of solutions you hear here on stage are all needed. It's adolescents struggling with alcohol use are going to have may favor a crowdsourced, peer-based solution, whereas someone else might, with intractable social anxiety, may need a more in-person and personal treatment experience. All of those range of options can be amplified and improved and more effective in multiple ways through technology. And we have to be that creative to reach that spectrum. This is a real challenge, though, to the healthcare system, to be a partner in that re-envisioning of what access and treatment experience and prevention and promotion are like. They're not incentivized to do so.